everyone, 11G, and today I will be performing the return demonstration of preparing medication from a Ampule, Vial, and Parenteral medication administration using the intramuscular and subcutaneous. So, prior to conduct of the procedure, the first thing to do is to check the doctor's order and the patient's medication administration record, or MAR. This done so that we will able to identify the kind of drug is to be given to the assigned patient. We have to determine the drug's name, dosage, the route of administration, and the time it is to be given. Then check the medication administration record. Then we also need to check the label of the medication against the patient. Hindi mi, baba. Usap robot sa taas. Okay. Then we also need to check the label of the medication against the patient's medication administration record to ensure that we are going to prepare the right medication. Now in medication administration, it is important to perform the 3 checks of the administering medication. We need to read the label of the medication when it is taken from the medication cart, and we will have to read the label again before and after withdrawing the medication. Then organize the equipment. So also we need to organize the equipment that we will use so we can avoid stopping during the procedure and for us to conserve time and energy. The equipment that we have here are the alcohol pad, medicine tray, sterile water, cotton balls, micropore, and eggplant substitute for the actual skin of our patient later, aspiring needle, and a 1 and 3 cc syringe. Now I'm going to proceed with the preparation of the medication from a vial. So first, perform a hand hygiene and observe other appropriate infection prevention procedures. Prepare the medication vial for drug withdrawal. So if the medication still needs to be restituted, then the vial would contain the powdered form of the medication, and diluent must be added into that vial. After adding the diluent, we mix it thoroughly by rotating or rubbing the vial in between the palm of our hands. Then after doing that, I'm going to prepare a syringe. I have here a 1 cc syringe, and I'm going to open the socket, and it is important to remember that we can only touch the barrel and the plunger of the syringe to avoid contaminating the needle. Now since this comes with a needle already, I'm going to loosen it up so that I can connect my syringe into a aspiring needle. Then I'm going to open the aspiring needle, then connect the barrel into the aspiring needle. Ensure that the connection isn't loose, then mix the solution if necessary by rotating the vial between the palms of the hands, not by shaking. Remove the protective cap or clean the rubber previously opened vial with a aseptic wipe by rubbing the circular motion. Then withdraw the medication and then attach an aspiring needle as a agency practice dictates to draw a premix liquid. Is firmly attached to the syringe. Remove the cap of the needle, then draw up into the syringe that the amount of air equal to the volume of medication to be withdrawn. After doing that, I'm going to get my syringe and uncap it. Then I'm going to draw air into the syringe. Then the amount of air equal to the volume of medication to be withdrawn. Then carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Inject air into the vial, keeping the bevel of the needle above the surface of the medication. Withdraw the prescribed amount of medication using either of the following methods. Hold the vial down with the base lower than top. Move the needle tip so that it is below the fluid level and withdraw the medication. Then invert the vial, ensure that the needles is tipped in the below then the fluid level, and gradually withdraw the medication. So I'm going to invert the vial and draw the exact amount of medication needed. So after doing that, if you see an air bubble inside the syringe, then you can lightly tap the barrel to expel the air bubble. Then I'm going to remove the aspiring needle and throw it to the waste receptacle to avoid needle pick injury. Then connect this barrel to the appropriate size needle. Now I'm going to place the syringe with the medication into the medicine tray, and I'm going to write the medication ticket so that we won't forget the medication it is. The dosage for what is for the assigned. Now I'm going to use an ampule opener or a piece of sterile gauge or a alcohol wipe between your thumb and ampule neck or around the ampule neck, and break off the top by bending it towards to ensure that the ampule is broken away from yourself and away from others. Okay. I'm going to recap the needle so I can take the aspiring needle off. Then discard the aspiring needle into the sharp container so that we can avoid a needle prick injury, and connect the syringe into the right size needle. Tighten the cup at the half of the needle and place over the medication tray. I'm going to place this into the medication tray, and then I'm going to write the medication ticket. So, subcutaneous administration is the introduction of a small amount of solution into a adipose tissue beneath the skin by means of syringe and needle. So, first, to perform a hand hygiene and observe other appropriate infection prevention procedures.
To deter the spread of microbes.
So provide the client privacy and prepare the client. So prior to performing the procedure, I'm going to close the door and also adjust the curtains. So after preparing the medication, head over to the patient's room and introduce myself and verify the client's identity and explain the procedure to the patient, and also ensure the patient's comfort and privacy and security by closing the door and fixing the curtains, which I already did. And okay, good morning, Mom. So, I'm Lead DNC Aitona, your student nurse for today. So, Mom, may I see your wristband, please? Okay, thank you. So, Mom, can you state your complete name and your birthday, please?
My name is Mia Monica Icarata. My birthday is June 15, 2011.
Okay, thank you. So, just for explain the purpose of the medication and how it will be help using language that the client can understand. It includes relevant information about effects of the medication. So, Mom, today um, we'll be doing the administration of our insulin. So, insulin will help your body to control your blood sugar, and as you have a type 1 diabetes, okay? I'll be injecting you insulin in the subcutaneous layer of your skin over your abdomen. So, is that okay with you? Okay, good. So, now I will close the door so no one can disturb us while um, while I'm doing this, okay? So, now I will assist the client to a position in which the arm, leg, or abdomen can be relaxed depending on the site of this depending to the site to be used. So,
Obtains.
so obtain assistance in the holding of uncooperative client. Then after that, I'm going to assess my patient in the comfortable position in which the nagbalik po, wait lang. Nagbalik ang script. Edit na. Sige, 9. Select a site free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation. Select a site that has not been used frequently. Then apply a clean gloves.
Dominant tabulo. Operational naman siya eh.
Okay. As the agency protocol indicates, clean the site with an aseptic swab. Start the center of the site and clean it, widening circle to about 5 centimeters or 2 inches. Then allow the area to dry. Then after doing that, we are going to clean the selected site using a aseptic swab, which I've already did, and place the whole swab between the third and the fourth fingers of the non-dominant hand, or position to the swab of the client's skin above the intended site. Then prepare the syringe for injection and removes the needle cap while waiting for the aseptic to dry. Pull the cap straight of the avoid contaminating the needle by outside edge of the cuff. Then grasp the syringe in your dominant hand by holding it between your thumb and your fingers with the palm facing to the side upward for a 45-degree angle insertion, or with the palm downward for a 90 angle insertion. Prepare to inject. By using your non-dominant hand, pinch the skin hold the syringe in your dominant hand by holding it between your thumb and fingers steadily as if you are holding a dart. And depress the plunger with a slow, even pressure. Then inject the medication into the patient.
May ano na.
Huh?
Shy.
Remove the needle smoothly, pulling along the line of insertion while depressing the skin with your non-dominant hand. After doing that, I am going to remove the needle smoothly and at the same angle we inserted. If bleeding occurs, apply pressure to the site of the dry sterile gauge until it stops. Now, if the bleeding occurs, apply some pressure to the site with dry sterile gauge or cotton balls until it stops. Then we have to dispose of the used syringe into the waste receptacle. Assist the patient into a comfortable position. Flip down medication ticket if not using a AMAR. Okay, ma'am, how are you feeling? Fine, okay, thanks. Okay, good. So, since we're done, I'm going to head out now so that you can have some rest. And if you need anything, don't hesitate to call me using the call button so that I can come back here and to attend your needs, okay? Okay, thank you. Proceed to the preparation of the medication in a ampule. So, this is what an ampule looks like. So, perform hand hygiene and observe other appropriate infection prevention procedure. So, before I do that, I'm going to perform hand hygiene to observe appropriate infection. Then I'm going to prepare my my syringe. So I have here my 3 cc gauge 23 syringe for my intramuscular injection. I'm going to open the packet, and since I already did it, and since my syringe come with a needle, I'm going to loosen it first so that I can connect it into a aspiring needle. So an aspiring needle will help reduce the risk of having glass inside the medication. So I'm going to connect my syringe into the needle and make sure that the connection isn't lost. Then I'm going to set it down first. Flex the upper stem of the ampule several times with fingernails. Use an ampule opener or a piece of sterile gauge or a alcohol wipe between your thumb and ampule neck or around the ampule neck, and break off the top by bending it towards to ensure that the ampule is broken away from yourself and away from others. So after doing that, we're going to disregard the broken neck of the ampule in the sharps container and set it down. Then with a single dose ampule, holds the ampule slightly on its side, aspirate the medication, then we're going to get our syringe and then we're going to draw out the medication. If giving an injection, replace the aspirating needle with a regular needle. cap the needle so I can take the aspiring needle off. Then discard the aspiring needle into the sharp container so that we can avoid a needle prick injury, and connect the syringe into the right size needle. Tighten the cup at the half of the needle and place over the medication tray. I'm going to place this into the medication tray, and then I'm going to write the medication ticket. So now for intramuscular injection, we need to select a site that is free for skin lesions, tenderness, swelling, hardness, or localized inflammation. If injections are be frequent, alternate sites. Avoid using the same site twice in a narrow, but remember it should also be exact site for the injection. So locate the exact site for the injection, then apply clean gloves, which I already did. Then clean the site of the with an aseptic swab using a circular motion. Start at the center and move outward about 5 centimeters or 2 inches. And remove the needle cover and disregard without contaminating the needle. If using a pre-filled unit dose medication, take caution to avoid dripping medication on the needle prior to injection. If this does occur, wipe the medication off the needle with a sterile gauze. So inject the medication using the Z-track technique. Now we're going to inject the medication. Ano ko? Inject the medication. Okay, inject the medication. Uses the ulnar side of the non-dominant hand to pull the skin approximately up to 2.5 centimeters to the side. Under some circumstances, such as for a emaciated client or an infant, the muscle may be pinched. Holding the syringe between the thumb and the forefinger, then pierce the skin quickly and smoothly at 90-degree angle. Then hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger with your non-dominant hand. Okay. So withdraw the needle, discard the syringe, and prepare a new injection. If blood does not appear, inject the medication steadily and slowly. Okay. So I already withdraw the needle, skin at the same angle of insertion. Then apply pressure to the injection site. It is not necessary to massage the area of the site of the injection. If bleeding occurs, apply pressure with a dry sterile gauze until it stops. Then activate the needle safety device or discard the uncapped needle and attach syringe into the proper receptacle. Then disregard the syringe into the waste receptacle to avoid needle prick injury. So, okay. So, mom, we are done with your intramuscular injection. So, how are you feeling po, ma'am? Okay, that's good. Since we're done, I'm going to let you have some rest and gonna head out. And if you need anything, just use the call button so that I'll be notified at the nurse station and come back here to attend your needs. Okay, thank you. Do aftercare, then removes the gloves, dispose used items in appropriate waste receptacles, then return the other equipment to its proper place, especially the MAR machine. After doing the procedure, disregard the gloves and also perform a hand hygiene. After that, I'm going to assess the effectiveness of the medication at the time it is expected to act. Then document all the relevant information and during the procedure.